Good afternoon, everyone. Welcome to another Zoom presentation hosted by the Center for Lifelong Learning here at the University of Aruba. And today is December 10th, and my name is Deborah Alexander, and I'm the coordinator for the Center for Lifelong Learning, for those who don't know me as yet. Before we start with today's presentation, as always, I ask you to use the chat box for general remarks. I would also like you to use specifically the Q&A box for your questions, because the answers will be provided during or at the end of the presentation. I would also kindly request that you fill in the evaluation form at the end once the presentation is over and you close your browser, and evaluation form will pop up. I encourage you to fill it out, and if not, we'll stalk you back tomorrow with a reminder. And last but not least, this video will be made, it's being taped and will be made available at a later date so that you can watch or share with others. Before we continue to our guest speaker today, I would like to give the word to Edward Drescher. He's a lecturer here at the University of Aruba, the Faculty of Arts and Science, and works at the Department of Organization, Governance and Management, and is also the lecturer of the elective on which this presentation is based, which is called Politics, State and Migration. I would like to give the word over to you, Edward.
Thanks, Deborah. This lecture is part of a OGM free elective called Policy, State, Migration. And in this course, we explore how politics, the state, and migration relate. We do that with the help of several guest lecturers from different disciplines. And in the lecture, we address questions like, why do people migrate? What does it mean to have citizenship? Who has the right to live where? How do borders and citizenship relate? How does sovereignty relate to inclusion and exclusion? What does it mean to be a refugee? And how does a refugee crisis relate to human rights? And what political responsibility do we as citizens have towards refugees? The two lectures are part of the free elective. We decided to make them public because we all think it's a very important topic, and it should be shared with as many people as possible. So last week, we enjoyed a lecture by Kelly Benelo. This week, we're going to listen to Yiftach Millo. Today's lecture is part of a two-part series, as I said. It will present the current challenges faced by refugees, asylum seekers, and migrants in Aruba, and how HIAS is implementing humanitarian interventions on the island based on its three signatory approaches: gender-based violence prevention and response, mental health and psychological assistance, and economic inclusion. So I think we should go to the next slide. Yeah. So our lecturer is Yiftach Millo. He is country director of HIAS Aruba. This is an international NGO working to welcome refugees and advocate and support their dignity, safety, and well-being. He has over 20 years of experience working for UNICEF, UN Peacekeeping Department, UNHCR, Oxfam, Concern Worldwide, and he has in Africa, Southeast Asia, Israel, and Latin America. In 2007, he founded ISAF, Aid Organization for Refugees and Asylum Seekers in Israel. And he initiated and taught academic courses on refugees, migration, and international development at Ben Gurion University and Sapir Academic Center. In recent years, he focused on leading research-based projects through HIAS, focused on protection of LGBTI refugees and inclusion of refugees who are survivors of sexual and gender-based violence in prevention and assistance programming. He has published extensively on issues related to forced migration. He holds a bachelor degree in history and African studies from the University of Tel Aviv, and a master's degree in development studies from Melbourne University, Australia. And with that, I would like to give the word to Yiftach. Welcome.
Welcome and buon tardi, everybody. And thank you, Edward, for this opportunity. This is the second year that we are conducting this lecture, and I'm really happy that we have this opportunity to open up to the wider public and have more participants listen in. In this lecture, I will basically focus on 3 of Hayes's signatory approaches, and I will share with you my PowerPoint so you can follow it together with me. Is this on? Do you see it well?
Yeah.
You have to do it widescreen, Yiftach,
Just looking
at the slideshow at the bottom, if not upstairs. Yeah.
What did I do?
Yes. We're just close to the minus sign at the bottom.
Would you see it? I'm sorry.
And if not, I think you'll see it in the slideshow above. So in your PowerPoint, it says slideshow at the top, yes. And from the beginning, yes.
Okay. All right, good.
Yes,
All
there we
right.
are.
Sorry for that. You know, even with 8 months of working with Zooms, I'm still there are some troubles.
That's okay.
Okay, so I will speak to the signatory approaches that Hayes is using here in Aruba, and speak generally about Hayes's role in humanitarian assistance around the world, but especially and specifically about Aruba. And I'll be happy to answer your question. If you have a question, you can also write it down in the Q&A, and I can relate to them while I'm presenting. So the purpose of this presentation is to present Hayes and our work here in Aruba, and share with you also the framework of Hayes's 3 main signatory approaches that we use in Aruba. We have around 6 of them that we use around the world, but these are the main 3 that we are using here. And also I'll be happy to discuss with you existing gaps in humanitarian and protection programming in Aruba. And if we have time, maybe we can also look at solutions or suggestions to mitigate some of these existing gaps. So I'll start with an introduction to Hayes. So Hayes is one of the probably the first international organization to work with refugees. It was established by refugees in 1881, Jewish refugees in New York, who came together to try to assist their brethren escape from persecution in Eastern Europe and arrive safely in the US. Throughout the years, Hayes was assisting Jewish refugees from all over the world, especially with the persecution of Jews during Nazism in Germany, before World War II, during World War II, and after the Holocaust, trying to resettle and find safe havens for Jews all over the world. Hayes had offices almost in every country, trying to send people to safe places. They even sent people to Curacao, Ecuador, places in Africa, Zambia. And today, when you ask American Jewry, a lot of their ancestors, meaning their grandparents, were resettled by Hayes to the US. So it had a very significant role in Jewish history in the 20th century. Unlike other organizations, Hayes always focused on resettlement of Jews around the world and not specifically in Israel. The vision of Hayes is to stand in a world which refugees find welcome, safe, and find freedom. And our mission is to rescue people whose lives are in danger for being who they are. We protect the most vulnerable refugees, helping them to to build new lives and reunite them with their families. We also advocate for protection of refugees and assure that displaced people are treated with dignity they deserve. HIAS is working in around 16 countries around the world, so our main focus is in Latin America. And you can see we work we actually started in Ecuador, and I think we're the largest refugee agency in Ecuador. And then we also working in Venezuela. We're quite a large operation with over 13 offices in Venezuela. We recently, due to the situation in Venezuela and the flight of migrants, refugees, and asylum seekers, we extended extensively, and in the last 2 years have opened operations and offices in Peru, in Guyana, in Aruba, and before that even in Panama and Costa Rica. In Mexico, we work along the border with the US, where we are providing legal assistance to those who are seeking asylum in the US and have to apply for asylum at the moment due to Donald Trump's new policies on the Mexican side. In Africa, we work in Kenya and in Chad, and I was also the one who started the operations in Chad in 2005. In Chad, we work mainly with Darfuri refugees from Sudan, from the western part of Darfur, who were fleeing persecution. In Europe, we work in Greece, in Austria, and Belgium. The Ukraine, we have now, HIAS Ukraine has become a local NGO and is no more under HIAS. And then we work also in Israel, which is also the country where I'm from. We work there mainly with African refugees that arrive from Sudan and from Eritrea. And I want to also to mention that HIAS is also one of the 9 agencies that are also working on resettlement to the United States. So we are processing potential people that are risks in countries of asylum and need resettlement to a safe country, and HIAS together with UNHCR and the US government, we are also working on resettlement to the United States. We have a network of ex-refugees who act as volunteers in many cities in the US. A lot of them are Russian Jewish grannies who were brought to, who were resettled in the US in the 70s and 80s. And today they are welcoming newly arrived refugees from the countries that HIAS is working in. In recent years, due to the exclusion of some I think it's the inclusion of 7 countries by Donald Trump, we also have difficulties in resettling some of these refugees that we work with, especially Somali refugees that HIAS works with in Kenya, in Nairobi. I think, Kelly, if you correct me, I think Sudanese as well are on the list. I'm not sure if Sudan is on the list, but it might be. HIAS Aruba and our operations in Latin America are really here in response to the Venezuela situation. And as probably Kelly mentioned last week, we have up to date around 5.4 million Venezuelan refugees, asylum seekers, and migrants that have left the country. and moved all over Latin America, Central America, and the Caribbean. The largest host is Colombia with 1.7 million Venezuelans. Then it's Peru with 1 million, Chile with 457,000, and Ecuador with 417,000. And the expectation is that these numbers will continue to grow due to the political situation, economic situation, and the impact of COVID-19 as well. This is some just information about the funds that are available for this assistance. We have a platform that probably Kelly mentioned as well, which is the platform for the response for the Venezuela situation, which is led by UNHCR and IOM, the International Organization of Migration. And in that platform, we have a lot of implementing partners, civil society organizations, and other actors that are involved in humanitarian assistance. And this is the budget appeal that came out. And at the moment, as you see, only 45% of the funds needed were actually raised as of today. So the need is quite huge compared to the resources available. Regarding Aruba, there is an estimated 17,000 Venezuelans on the islands that are either asylum seeker or migrants seeking asylum. This number is an estimated number. There's no registration currently in Aruba. We know that last year, around 2,000 Venezuelans applied for asylum through DIMAS in Aruba, but there's no real data. But this is the numbers that we reached some kind of an agreement between the government, civil society, and agencies that are working with this population. And according to that, we are currently working. This is quite a large number because we're talking about 15% of the island's population, which is quite significant if you think of other countries. And basically, at the moment, at least in Aruba, there is a right to, they do exercise the right to access to asylum, but it is somehow limited. And we know that even, the links and information on how to seek asylum on the DIMAS web page is not there in the last few months. So there is some questions regarding the free access to asylum. Also refugees do exercise access to education, and we see many of the children participating in school. We don't know the number of children that are not really in school, but these are the main two rights that Venezuelans do manage to access, and other rights are limited because until now, there were no Venezuelans who were recognized as refugees and therefore could not exercise most of these rights. And in Aruba, while you're an asylum seeker, you still don't have access to healthcare, to formal employment, etc., which leaves the majority of Venezuelans in a situation of limbo, where they are living in a space which is considered illegal, marginalized, and therefore are exposed to abuse, to risk, in order to survive. Is there a question here? I don't see the... Highest Aruba was formed in February 2019 as a local stichting. We are based in Arnstraat 116. For the first year, we shared the office with the UNHCR, and ISS grew quite significantly, also UNHCR. And we have at the moment 14 staff members. Our target population is mainly the Venezuelan asylum seekers, migrants, and refugees. We also assist refugees from other nationalities, and also assist the most vulnerable from the host community, meaning Arubans, and other migrants from other nationalities, but the majority, or quite a significant attention is dedicated to the Venezuelan population on the island. In 2020, around now, we have had contact with at least 2,400 Venezuelans, which we providing several services to this population. And our areas of intervention is what we try to do is really try to identify the most vulnerable amongst them. Our resources are limited, and so are the resources of our partners. And therefore, we try to, through different mechanisms, to try and identify the most vulnerable individuals, most vulnerable families, and assist them in mitigating the risks they are facing. If it's risks to their safety, if it is risks to their well-being, or if it is risk to their dignity. So we do case management of these most vulnerable population. We sit with them, interview them, and together with them work on a plan on how to mitigate some of these issues. Some of these issues are not really resolvable, but we try to do our best in the existing conditions, which is a limited protection framework, a limited economic environment that they can access, limited access to health, as I said, and limited access to integration. To mitigate these risks, we use several mechanisms like cash-based interventions, where individuals or families that are in need and are at risk can receive financial assistance to cover some of the issues that might impact and diminish the risk that they are. We are providing mental health and psychosocial assistance through counseling, support groups, a lot of trainings and webinars on first aid, psychological aid, and other mechanisms for psychosocial assistance. We are also working with gender-based violence survivors and people at risk, mostly women, but also LGBTQ. We also have at least one male case that we are assisting as well. This is quite a challenge for us working on GBV, because it is a challenge for the whole of Aruban society, and I will provide some more information when I'll talk specifically about the GBV. Just one moment, I just try to see if I can get that. Do you hear the noise in the background?
Not at the moment.
Okay, fine. Okay, that's good. I see that there's a question regarding how people can apply for asylum at the island here in Aruba. As I mentioned before, there was you could apply through the DMAS website, and maybe Kelly, you can provide. I don't know if Kelly is still here, can provide an update if this possibility has returned and the links and information is back on the website. Otherwise, you're supposed to do it at the point of entry at the airport, or later you can go to DMAS and apply. The only thing is that at the moment, DMAS offices are closed to the public, so it's almost impossible to apply for asylum there. But at the airport, you can apply and through the immigration officers. Just one moment. But as I said, it's quite limited at the moment, and the majority. I mean, the policy itself is a policy of rejection, in a sense that Aruba, like many other countries, including my own country, Israel, is using a very conservative and limited interpretation of the 1951 Refugee Convention, basically recognition of refugees only if they are persecuted on a religious basis, race, political opinion, of being persecuted because they belong to a specific social group, while Latin American countries that are signed on the Cartagena Agreement from the 1980s recognize refugees, also people that are fleeing countries where you have that the country is not functioning, where you have violence, where you have disturbances to the peace. So while in most Latin American countries, or we see it in Brazil, for instance, there's much more leniency and it's an inclusive interpretation of who is a refugee. Here in Aruba and other countries in Europe or Israel, for instance, are quite restrictive in that. Other services we provide is back to school. We assist, this year we assisted around 213 Venezuelan children to register to the school. We assist vulnerable families that lost their income and ability to access employment, and because they are not residents, legal residents, they don't get the FASE or any kind of assistance from the government. We assist them in covering the registration fees to the school, uniform and insurance, etc. We also provide medical packages, up to 450 florins per person per year. Again, our resources are limited, so we cannot cover everybody's medical costs, and this creates a gap, especially when people have more chronic issues and needing long-term treatment, or they have serious injury or illness. And this is unfortunately something that at the moment is not really covered, not by us or not by the government, and people enter debt agreements with the Aruba hospital. We provide hygiene packages to women and girls. We believe that due to the economic crisis, families and households need to prioritize their expenses, and we want to make sure that women and girls get an equal opportunity to live with dignity and have the mobility to participate in society. And this is why we have been doing this kind of distribution. And I think it was 2 weeks ago, last week we did it in San Nicolas. We are working on economic inclusion and providing financial literacy courses on budgeting, on marketing, assisting people to plan better their household's economy, and market any kind of products that they are selling or working with, assist them in improving their economic access. Okay, I see there's a question regarding schools. When registering to school, which schools are these? Are these special schools seeing language barrier between Spanish and Dutch? So until last year, refugees, migrants, were going to the regular school, meaning DPS, and mainly DPS, COA, EPB, and those that Dutch was new for them were going to the Prisma program, which was a 1-year intensive assistance in Dutch, and from there they would move to a regular class a year later. This year, the Ministry of Education decided to make some changes, and at the moment, SCOA is the only education board that is providing the Prisma program. Most of the migrants are these days being absorbed either by SCOA through these Prisma classes, or they're going to a school that is the Adventist Academy in San Nicolas, run by SWASA. It's an Adventist NGO. And there, the ministry is facilitating, together with the Adventist NGO, a new program that follows the American curriculum in Spanish and in English. The teaching itself is done through teachers that are based or work for 2 private companies, one in the US, one in Puerto Rico. And the children are following these classes through remotely through a computer, and they online, and they have Aruban teachers as assistants in the class. At the beginning, we were quite skeptical about this system because we never encourage separation of children from the national education system. But we saw that a lot of parents were actually very interested in that system. And we'll have to see and monitor how these schools are functioning, if the kids not just attending school, but they're also improving and managing to perform, and see how this will work for the years to come. And we need to make sure that these kids are also learning Dutch, because at the end of the day, you have to learn Dutch if you want to integrate, and at the end of the day, receive status in Aruba, especially in nationality. In SWASA, they are teaching Dutch as a second language. We have some obstacles for children who are going to EPB or SVGA because of the insurance. The insurance is quite costly, and unfortunately, I think it was 2 weeks ago, because most of these families could not cover the insurance, children from EPB were sent home, and we are working with the Ministry of Education to resolve this issue. We also work on advocacy with the government, together with UNHCR and Aruban civil society and the International Organization for Migration. We coordinate with the government and work with several departments and ministry. We work very closely with the Ministry of Education. We have good relations with the Department of Health. We work with social affairs. Yeah, that's more or less. There's a referral mechanism between government agencies and HIAS, and from HIAS to government agencies, and also between different civil society organization, mainly UNHCR, IOM, the Red Cross, Fundación para Gente Mujer en Dificultad, Fundación para Nos Comunidad, etc. We also provide integration activities, meaning language courses, Propiamento, English, and Dutch. And we are working with volunteers from the Venezuelan community and Aruban community for improved protection that is based on the community, meaning identification of vulnerable individuals and family, people in need, survivors of gender-based violence, people who need psychosocial assistance. We want to create a network of people within the community that have basic skills to identify these people, perhaps even provide first aid psychological assistance, and then refer them further to HIAS or other partners. This was quite a challenge during COVID because most of us were closed in, but hopefully in 2021, we'll be able to establish a more robust network. So what are the highest signatory approaches? So highest works to protect the fundamental human rights of refugees as established in different conventions and international law, meaning that highest will engage in any areas where we see gaps in the ability of refugees to practice and access their rights. Of course, due to a limitation of resources and expertise, we are not able to deliver services in all these areas, but we do work to advocate changes in most of these areas. Here in Aruba, we do deliver services, as I mentioned, in 3 signatory approaches. The first one is gender-based violence prevention and response. The second one is mental health and psychosocial services. And the third one is a new one, economic inclusion, which we are starting at the moment, November, December. So I'll introduce these 3 signatory approaches. So gender-based violence, prevention and response. Maybe I'll provide a definition of gender-based violence. So gender-based violence is most commonly referenced in humanitarian setting as gender-based violence is an umbrella term for any harmful act that is perpetrated against a person's will and that is based on socially ascribed gender differences between males, females, in general. There's also specific guidance that the humanitarian community is using to provide prevention and response services, and HIAS is one of these organizations that follows these guidelines and also assist in developing these guidelines. The underlying cause of gender-based violence directed is unequal power, but there are also other differences in powers or gaps in powers that strengthen vulnerability to gender-based violence. We see that mostly with refugees and migrants, because many of them are exposed to double jeopardy or even triple jeopardy or risk because of their gender, because of their gender and being women, and the inequality of power between men and women in most of societies, and because they're foreigners, they're migrants or they're refugees, and there are xenophobic tendencies that also puts these people, do not grant them power and rights to exercise their rights. So there's sort of a double jeopardy or double risk that is characteristics of this situation. There's also triple jeopardy if we're talking about LGBTIs and sexual orientation, or when we are talking about people with disabilities or people who are elderly and might suffer discrimination because of their age. So we see that there's quite high vulnerability among certain population of migrants and refugees that is more exposed to gender-based violence. And here in Aruba, the fact that we are talking about women and women who do not have status on the island, and women in a country where xenophobia is mostly is very gendered. It's very targeting of women and their characterization or stigmatization in regards to their sexuality, and the presumptions that many Latin women or Venezuelan women are engaged in sex work. So the risk, especially here in Aruba, for Venezuelan women is quite high. And this is even augmented by the economic difficulties. And HIAS conducted a GBV safety audit in February 2020. This is sort of a rapid tool that we use to get a snapshot of the issues that are impacting women, girls, men, boys, and LGBTQ in Aruba, and see what are the risks and what are the risks that migrants are exposed to according to gender. And we focused mainly on women with elderly women, women who are singly heading households here in Aruba, women as mothers to children with disabilities, and women who are partnered, either with Venezuelan or non-Venezuelan partners, but they're not married. And what we discovered that there's three main thematic areas. One is isolation. The fact that people don't have a regular status in Aruba puts them at risk of detention and deportation back to Venezuela, meaning that they live with fear and they isolate themselves. They don't have a very elaborate social network. They go to work, come home, and they don't move around too much, so to not be exposed to the possibility of detention and deportation. Also, transportation is very costly in Aruba, and it's not very developed in all areas of the island, meaning that there are obstacles on movement. And as I mentioned before, there is gender-based xenophobia, especially against Latin women, maybe specifically towards Venezuelan women, and maybe other women from other Latin American countries. The second issue is lack of access to resources due to the fact that migrants, asylum seekers don't have access to formal employment. It means that they have to work informally, be employed through contractors, and then be at risk of exploitation, be it labor exploitation, but at times also sexual exploitation. It can mean also being exposed to the possibility of human trafficking or forced labor, and also engagement in survival sex in order to feed themselves, families, or children. This also means that we see quite a lot of dependency in relationship some women are forming in order to survive. If you're a single mother with 2 or 3 children, and you are being either being psychologically or physically abused by your partner, at the moment in Aruba, as a Venezuelan woman, you don't really have much of an alternative, and people tend to stay in these dependent relations that may also be violent relationships. Another thing is people really don't know what are their rights. There's no clear protocols and understanding of what GBV survivors can do, who they need to approach. If they approach the police, then they are scared that at the end of the day they might be detained and deported. There's no clear information regarding survivors, GBV survivors who don't have a status. If they complain or if they even want to go to court, how long would the authorities let them actually stay in Aruba? And there's a real concern on their side that if I go and complain, I will be deported. The other thing is limited access to services. As I said, People are scared to reach law enforcement. People are living in informal rental contracts, so they're also at risk of abuse from landowners, and the lack of movement and transportation also means that there's lack of access to healthcare, to organizations like HIAS, the Red Cross, and others who provide assistance. So there's quite a lot of obstacle for survivors of GBV. And here I'm focusing on migrants, but I think we all know that the response to gender-based violence in general in Aruba is still lacking, and resources are quite limited. Luckily, I think with Dutch funding, there's going to be expansion of the shelter of Fundación para Gente Mujer en Dificultad. But at the moment, at least, issues regarding to GBV, if they reach the authorities through the police, are being referred to Slachtofferhulp, and their capacity is extremely limited, and they're dealing with all victims of crime across Aruba. So at the moment, the response is extremely limited, and I think there's quite a lot of taboos and cultural limitations also to the issue of prevention. In the countries that we are working with. So the first thing is really working towards the promotion of rights of women, of girls, and LGBTQ persons as the most sort of vulnerable populations that might be affected by gender-based violence. And I wanted to mention that I did a research about LGBTQ plus refugees around the world. It was in Ecuador, Ghana, Kenya, and Uganda. And I think most of the refugees that I've, it's not most, it's 100% of the refugees that I've interviewed were survivors of gender-based violence. And I would like to also clarify that the fact that you left your country and crossed the border because you are being persecuted for your gender or for your sexual orientation doesn't mean that in a neighboring country the attitudes are different. And a lot of times they moving to another country, crossing the border, becoming a refugee does not really resolve the issues. HIAS also challenges issues related to gender inequality, and we do that again through advocacy, through trainings, through capacity building of local stakeholders. The third strategy is creating social, political, and economic environments in which women, girls, LGBTQ are empowered to enjoy those rights. And again, we do that through support for local organizations, for human rights organizations, for refugee-based organizations, working a lot with women's group and also LGBTQ groups. This is quite developing in many of the countries that HIAS is working in. But here in Aruba, as I said, Venezuelans are not that organized because of the issue of the fear of detention, and these structures are quite limited here in Aruba. We also, the services that we are providing are survivor center services. So we work with survivors, try to understand what their needs are, providing them a sense of control and a pathway for recovery make sure that they lead the process, that they have the power to make decisions, which is quite tough in a place that is a small island. And this is true for all survivors, due to the fact that in a small island, it's quite difficult to find anonymity. It's quite difficult to find a shelter away from the perpetrator. And the issue of protection is a bit more complex when we're talking of a small geographically. With COVID-19, we saw an increase in the number of cases of GBV survivors who approached IS. And this could be attributed to the increased isolation. So families or individuals are closed at home and have even less contact with friends, family, social support. This also increases, stress, depression, anxiety, and tensions within the household. There's increased economic distress for Venezuelan migrants because the majority lost their ability to work. They lost their resources, and they find themselves in a very stressful situation where they cannot maintain themselves in Aruba, let alone support family members, children back home in Venezuela. So we see an increase in GBV cases, and we know from other organizations that this is across the board, and it affects Aruban, Venezuelans, other migrants, and this is a situation that is very worrying. HIAS had so far identified 60 women survivors of GBV and 2 men, and we are providing them with psychosocial assistance, with counseling. For some, we provide financial assistance to find alternative shelter away from the perpetrator. We assist, as I said, to their children in issues of registration to school. We also provide assistance to healthcare. And if we can, we also we conduct support groups for women who are survivors, and in the future try to focus a little bit also on issues related to livelihoods and skill building. So these women, majority as you see are women, could become independent and assure their independence. So the principle of the response is based on protecting and promoting rights, as you saw. It is not about, it's nothing about us without us, meaning that we don't force anyone to do anything. It is all up to you, and this is a survivor-centered approach. In general, working towards equality through equity and making that people have equal access to resources. Capacity development, if it's of our own staff, if it's the community, if it's leaders within the community, both migrant Venezuelans, people from other nationalities, or providing training to organization on the islands. And we just finished a 6-week training of Fundación para Gente Mujer en Dificultad, and also creating activities through partnership. And we just today we are completing the 16 days of activism against gender-based violence, and together with UNHCR, with IOM, and other organizations, we conducted a webinar, we distributed hygiene kits, and also did some campaigns in the media. I think we more or less touched about the intervention that HIAS provides to survivors, so we can move on to the next theme and the next signatory approach, which is mental health and psychosocial services. And you need to understand that what we are really trying to achieve is really build resilience on the individual level, the family level, and the community. Now, this is challenging because in a sense of community, it's quite difficult to understand or figure out who the community exactly is. Is there a Venezuelan community? Are there communities that are actually based on neighborhoods and not on nationalities or any kind of backgrounds? Who is the community that we are supposed to work with and strengthen their support for individuals who are experiencing mental health difficulties and psychosocial services? In general, I would also say that due to COVID-19, we see an increase in the need for mental health and psychosocial services due to the impact of COVID, the stressors of the economic impact, the isolation, and I think this would be a global phenomenon that we'll see all over the world, the impact of the pandemic on the mental health and psychosocial state of humanity. But we have to understand also that, displacement is a very disruptive phenomenon. You basically move from a society, community, family that you understand the language, you understand the values, you understand the cultural symbolism and the significance of different habits, rituals, and suddenly you find yourself cut off from all that, which means that you have to adapt. And not everybody is adaptable in a very rapid way. Each one has his own strengths and its own weaknesses. And there are issues that are quite difficult pertaining to age, pertaining to economic, social-economic status, and also legal status. So routines are being broken, social networks are being broken, people fall from one socio-economic status to another, which can be a great impact to self-esteem. If you move from one country to another, there might be also a huge gap in infrastructure. For instance, when I was in Chad, Sudan was actually more developed than Chad. And we didn't have the infrastructure that people were used to beforehand. And also people have different perceptions of safety. The last 5 years I lived in Brazil, and when I came to Aruba, for me it was the safest paradise you can imagine. But some people told me, no, you have to be careful. There is some crime, but for somebody who comes from Brazil and probably someone who comes from Venezuela, this is quite insignificant. But if it's vice versa, can be quite shocking. And you see that amongst refugees, for instance, who arrive in Brazil, not really aware of all the dangers that are there. HIAS response, as I said, is really about building resilience, and we do that through negotiating, managing, and adapting to significant sources of stress or trauma. So we do that through various tools of evaluation, and according to the need and ability of resources, we provide several services that impact, if you look at the socioeconomic model, either the individual level or the relationship level or the community level. We are not there still at the societal level. As an organization, our goal is to work actually and focus on the community level. But as I said, because it is quite challenging here in Aruba, in a sense, to really define what is the community, that we find ourselves also with quite a focus also on individual assistance. And when I mean individual assistance, it's counseling. So we have one-on-one counseling, and during COVID, it was done remotely by phone. When we're talking about interpersonal and relationship, we're also talking about counseling, but also support groups. And we have different support groups, if it's based on gender, if it's based on age, if it's based on issues like depression, or if it's based on, if it's specific for survivors of GBV, etc. On the community level, we also provide support group and social activities. And our intention was this year to have Hayas, our offices in Arenstraat, as a social center, because we thought if people are so isolated, I'm sure they would love to gather and feel safe and meet each other and talk and support each other. And unfortunately, COVID arrived and made a bit of a mess of our plans. But at least during the months of May, June, July, when we were non-COVID island, we had a lot of activities, and the place was buzzing with people. And I think we are going to continue that next year, because I think it does provide a lot of support, connecting people and providing them skills and a sense of a purpose. Because, you know, if you don't work for a year, if you don't study anything, you feel that you're wasting your time, especially if you're a young person who just want to start his life. Somebody asked, how do you apply for the services? So we have a hotline, which is at the end, there is the number, which is 730-7770. So you can apply through the hotline. You can apply through our email, which I will give later as well. We have a Facebook as well. You can be referred by organizations. You can also come to the office and register, so you can have an appointment. Unless it's very, if it's really an emergency, then we serve you immediately, but otherwise we'll make an appointment, because the need is great, and we cannot really cover everybody. I just want to say that all these services are being coordinated with other organizations, especially IOM, UNHCR, Red Cross, so we can increase the coverage and make sure everybody is covered. And while the Red Cross, for instance, is now really focused on distribution of food vouchers, we are assisting more on the financial side and the psychosocial side, also the GBV area. In the MHPSS, our partners are Respaldo, the Department of Psychiatric Services. We have one psychologist and 2 counselors in our team, but we have also 2 volunteer psychologists that work mainly with children. And we also have volunteers who teach yoga and do other kind of well-being activities and exercises, if it's here in the office. Or on the beach. And hopefully next year, you know, if we manage to conquer the COVID challenge, we would be happy also to conduct such activities in the different neighborhoods, not just in Oranjestad, but also in San Nicolas, in North, and everywhere else. The third signatory approach is economic inclusion. At the end of the day, without economic inclusion, we are leaving migrants, refugees, asylum seekers in a constant state of exclusion and marginalization. Without sustainable economic capacity to sustain their households, they will always be dependent or living really in a marginalized space, which is prone to risk. And at the end of the day, affects everybody, because you cannot really separate migrants from the local population. We are all living in mixed communities. And any issue, if it's public health, or if it's education, or if it's lack of finances, can lead to also negative coping mechanism, which at the end of the day will affect all Aruban society. So what we are trying to do, and this is a new pilot, is we are now working with 40 households that we identified that they are not the most vulnerable and they are not independent. People whose challenges are not extreme and they have the motivation, will, and even the history of being innovative, and working with them for at least 1 year to promote some kind of self-reliance in a very limited environment due to the legal challenges that they face here in Aruba. And that means that we will provide holistic support, which will involve psychosocial assistance, will involve financial assistance to secure basic needs, and capacity building, especially in issues of if it's on financial literacy, project development, business plan development of businesses, marketing, and might include even access to seed money to start small enterprises. We will provide a holistic case management and monitor and evaluate the project after a year to see what the impact is, and see if this program could be expanded to a larger number of Venezuelan refugees and migrants. We also include 6 Aruban households in the program as well. As a whole, we see quite a positive response from the private sector. I think the private sector is concerned about what happens when recovery comes and how Aruba can maintain its working force, especially the hotel industry, which was heavily dependent on migrants. And I think as a group of organization, we are trying to advocate for a win-win situation, because at the moment it's quite a lose-lose situation where migrants are working informally, they're prone to abuse. On the other hand, they don't pay taxes, so the government does not receive the revenue that they can later use for provision of education, health, and other services. While if there will be alternatives for legal employment, then these people could work with dignity. They would not lower salaries for Arubans because they will have the minimum wage, and they'll be paying taxes and not having to go to the hospital when the situation is already acute, and then it's expensive, and then they cannot pay it, and it remains a debt for the hospital and the Aruban health system. So it's quite a challenge, and we'll see how we progress with this new program. But we're very excited about it, and I will be happy if I'm here next year to follow up with an update and update you on the results. Just to finish, here is our Facebook page, our hotline, the email that you can refer people, and this is the highest website. This is the highest international, which is based in Silver Spring, Maryland. It's a suburb of Washington. And also, I would like to say that HIAS here is funded by UNHCR, by the United Nations High Commissioner for Refugees, and the Bureau of Population, Refugees and Migration at the US State Department. This is our two main donors for the operations here in Aruba. And thank you. I'll be happy to answer any questions.
Thank you, Yiftach. I think the last question you did answer. I think, how can people apply?
Yeah.
So yeah, this is definitely it. If there are any more questions, please post them now. Thank you for a very interesting presentation, Yiftach. I am also looking for Edward. He disappeared in the process.
I'm here.
You're there. Do you have anything that you'd like to add to this, Edward? Because it was a quite, straightforward, clear presentation, very informative, and I believe that based on the questions that we received as well, that these were the questions and information that was missing. But Edward, is there anything else you'd like to add coming from your free elective?
No, I don't necessarily have something to add. I actually might have a question, if that's okay.
Yes, that's okay.
So I was wondering if you were talking about a network of volunteers. How could I or the people listening in, how could we help? What are the types of things we could do? Maybe volunteering in a certain way, but maybe also other things?
Sure. First of all, I want to say that we, in a year and a half, have an amazing relationship with the university, especially the Department of Social Welfare. We had 2 interns or 3, no, we had many more last year. And 2 of them has joined, 3 of them has joined our team and are part of HIAS. We are having another 3 or 4 starting in January as well. And I think it was an amazing experience for us and for them. And I'm happy that we are managing really to integrate the Department of Social Work in practical work, which is really being exposed to humanitarian work in general and can also lead for an international career in a sense. So I'm just mentioning to the students, and in a sense, we have volunteers for several issues. One is teaching any kind of skills. We have people teaching Dutch, people teaching drawing, people doing art activities, whatever. If you have a talent you want to teach and share, we would love to have you. People are eager to go out, express themselves, meet, talk. So any kind of talent activities, we had a plan to do sports as well, but with COVID, it's a bit difficult. So this is one thing that, I'll be happy to have you integrate. The other thing is we need a network of people to assist us sometimes in assisting people to go to the hospital, to, if there is an acute issue or an emergency and we need somebody to assist, especially in transportation, bringing people to the hospital or to the clinic, or take them for chemotherapy at IMSAN, or, this is something that we will be happy to have volunteers for that. And the third thing is really, we have a network at the moment of 20 community mobilizers that are all Venezuelans. Not all of them are without a status on the island, some do. But we would like from next year, from January, to expand it and include also Aruba. And so the network will be much more integrative. I think you cannot put people in isolation. And what this networks brings to the table is sort of an interdisciplinary resources that we all have. If it's knowledge, if it's contacts, if it's ideas, if it's activities, if it's assisting in advocacy, if it's conducting projects, we are very open to ideas and innovations, especially also on the issue of integration and anti-xenophobia, and issues that are related to that as well. So I'll be happy to receive your information and see how you can integrate. We'll be happy to meet you here at our office to get to know the organization better. Yeah, as I said, I think the university has proved itself as a very vibrant pool to the work that we are doing here in our.
And I would like to add to that before we continue to questions that just came in, that I'm sure that collaborating with the Center for Lifelong Learning, I'm quite eager in looking how we can partner together in ensuring that those who are here, that they can continue to develop themselves and therefore, you know, their professional and even their personal enrichment. So I'll definitely look forward to that, working with you. So we will be in contact. We received 2 questions, and the first one is, what does policymakers need to take into consideration for a more inclusive Protem for migration? Yeah.
So I think the first thing is really data, and we need data. Without data, it's easy to ignore the problem. When we have no clear numbers, when there's no registration, the whole issue is out of sight, and when it's out of sight, it's also very far from the heart and also the pocket. And once you have data, it means, yes, you'll have to face the issues that are in front of you, which is providing services, but you can then also approach the international community and ask for assistance and ask for funding and ask for support. Without data, without knowing how many, what is the number of asylum seekers, we know, but of migrants on the island that don't have a status, how many are the children that are here that need education. I think Aruba finds it extremely difficult to explain its stories and its challenges when you cannot really present data and numbers. Because I think those of us who are here are extremely aware of the challenges of Aruba in terms of how do you secure education services to this amount of people, and health is a major issue. But without data, you cannot really achieve that kind of support. And I think this is the first phase. The second phase is that, not phase, but the second issue is that, you know, I think for me at least, usually or most of the time I worked with refugees, mostly in Africa and the Middle East. But when here, I remember the first time I went and saw undocumented refugees or migrants from Aruba, and it was at night standing in front of a doctor's clinic who receives people after dark in hiding. And the people I saw looked like my dad and looked like my neighbors back home. And they were not different from me. And then you realize that, my God, this could happen to any of us. And Aruba, with a history of migration, needs to sort of recognize and come to recognize the diversity of this society, because Aruba is an extremely diverse place. And I think issues of identity should be discussed. I think also the Venezuelan story needs to be discussed, but I think there's a lot of taboos and there's a lot of fears. And we have to recognize that at least at the moment, the borders with Venezuela are closed. Yes, there are boats coming, but in very minimal numbers. But this population is here. You cannot ignore them. You cannot raise a generation of children who don't go to school, or you cannot let people who have diabetes or other health conditions just, let them die at the end of the day. And I think by not ignoring the issue, discussing the issue, bringing all the difficulties, even the xenophobia, that even the issues of the gender xenophobia, at the end of the day will open up to opportunities of greater support and inclusion. Because if you ignore the phenomena and the issue, it's like a time bomb. At the end of the day, it will explode in your face. And we shouldn't do that. We should gradually provide a space for these people to live in dignity.
Thank you. The next question, it says, so they thank you very much for that interesting presentation. I am curious to know in how far cultural conceptions on gender are taken into account as factors that increase the likelihood of GBV. Yes. If you could elaborate on these, and secondly, will the slides be made available?
Sure, I can send the slides to both of you, and then you can share it.
So I'll just like to add for the slides before you answer, just for anyone with the slides, they will be made available then with the video in our newsletter. And if you're not on our mailing list, this is a good moment to send us an email at cll@ua.aw before I forget.
And as I mentioned, there are the cultural elements there. As I see it, and I hear it also from colleagues, international colleagues that, especially women, I'm talking about women with, for instance, a Latin accent, the things that they go through, I don't hear it from colleagues that are, women that are from the US or Europe. So I think there is stigma, there is sort of a cultural bias and a gender bias towards Spanish-speaking women on the island, and it's and in that sense, I'm not just saying Venezuelan, but also other nationalities, for instance, I spoke to Sedem, who was supposed to work on gender equity, and I could sense the sense of rivalry, and I'm saying, we are. Don't you realize that we are all here manipulated by men here? It's one group of women against another group of women, letting men, still control and determine the hierarchy between all of you. And I think there is a lack, at least on the women's rights, women's equity, and the GBV scene here in Aruba. I think there needs to be much more unity between all the actors. And there's really need to be an overall advocacy, not focused on Venezuelan women, but on women at all, Arubans and non-Arubans, in terms of response. There's no clear legal framework. There's no clear protocols of what to do in a case that you actually identify a GBV case. And this is work. It's not really clear who also needs to lead this kind of work. And HIAS is an organization that comes from outside. I don't think we will take the lead, or we want to take the lead. This is something that Aruban society and Aruban women need to to take on. And in a sense, it's quite surprising when you come to Aruba and you see women in leadership positions everywhere, which is incredible. You know, you don't see it in many countries, and here it's so visible. But then underneath there are many other more difficult issues that are not really spoken of.
Yeah, thank you very much. Well, I think that was the last question. I would like to thank you, Yiftach, for that interesting presentation. I really appreciate it. It was very informative, and I'm happy and thankful to Edward and also to you and also to Kelly, actually, for wanting to break this presentation bigger than from the classroom and, you know, having it reach the community that it, you know, needs to reach, and therefore generates an awareness and understanding of the situation. I do hope that this would not be the last time that you join us in one of these presentations. And as I've said, you know, the University of Aruba is very happy to collaborate and work with you further. I see there's one more question, I think, that came in, and it says, what type of volunteer help is highest currently in need of? I think you did address it, but I don't know if there's something that you would like to add to the list already presented?
Just saying, if people have also specific skills, if they come from the area of counseling, mental health, we work with a lot of doctors on the island, any kind of specific skills that could be of service, we'll be happy also. You know, even we have volunteers who are graphic designers, or, you know, there's so much that you can do.
That's so much. Thank you very much. And with that, I would like to end this presentation, organized, as I said, by the Center for Lifelong Learning at the university. We're always happy to have you with us, and we look forward to having you soon again. And I think this would actually be the last presentation for 2020, and I look forward to seeing everyone in 2021. Have a wonderful evening, afternoon further, and until we see each other again.
Have a happy new 2021, everybody.
Yes.
And it was a pleasure to be with you.
It was a pleasure.
Pleasure to have you.
Bye-bye.